I see a lot of patients who come to see me for a tummy tuck. What they're really asking for is abdominal recontouring. The reason could be they've lost weight. The reason could be they've just had a pregnancy and their skin has been stretched out. Or the reason could be that they simply don't like the way their abdomen contours. When someone comes to see me for abdominal recontouring, there really are three general choices in how to proceed. One way is to do a liposuction. Liposuction involves simply removing the fat and letting the skin shrink back down. Some patients are good candidates for this operation, but there are a lot of patients whose skin has been stretched, whose skin is too thin, it's hanging, or there are other problems with it. So liposuction may not be a good solution. The second choice is to do a tummy tuck, and what this involves is removing the skin that is not going to shrink back and recontour if the only thing we did was taking out the fat. The tummy tuck operation has several parts to it. The first part is to make an incision in the lower abdomen. Typically, it is right at the level of the pubic hairline, or sometimes even in the pubic hairline, so that we can lift up the mons pubis. This incision is carried horizontally across the abdomen all the way to the hips. As far as depth goes, we'll want to cut through the skin and through the fat so we can get to the level where the fat and the muscle meet. We don't injure the muscle, but we lift up this fat at the level where it meets the muscle. This flap of abdominal skin gets lifted from the pubic area, essentially all the way up to where the ribs are. In doing that, I can expose the abdominal wall muscles. So the first step of the operation is you lift up the skin and the fat. The second step of the operation is to tighten the muscles of the abdominal wall. The muscles that you think of as the rectus muscles or the six-pack muscles, everybody has them, but sometimes they're simply covered with too much fat or skin that you just can't see. In someone who's been pregnant, they almost always have been stretched out, and no matter how many sit-ups you do, no matter how hard you work, how hard you exercise, you can tighten the muscles, but you can't tighten the connective tissue tubes that the muscles sit in. The second step of the operation is to tighten up those muscles. I'll make a series of sutures starting up at the top of the ribs and going past the belly button all the way down to the pubic area, and that's going to tighten the abdominal muscles and make those muscles much flatter. In addition, I'll put some sutures in the muscles on the side of the abdominal wall. That will tighten the sides, and it'll also tend to draw the sides in so we can create a more narrow waistline. Once the muscles have been tightened up, then the next step is to take this skin that I've lifted and pull it down and trim off all of the skin that stretches over the lower incision. That allows me to remove typically a large amount of skin. Ideally, I try to remove all of the skin from the top of the pubic area up to about where the belly button is. If I can take all of that out, then I can close this wound quite tightly and be left with a nice flat abdomen. Finally, what we'll find is that some patients still have a little bit of fullness either up over the ribs or over on the sides. So often the tummy tuck is combined with liposuction to help smooth out the areas that have residual fat. A tummy tuck operation is done as an outpatient, so patients come over, they have it done, they get to go home the same day. Normally we'll have an anesthesiologist who not only provides the anesthesia during the surgery, but will also provide some injections along the course of the muscles, so that does a great job of taking care of a lot of the postoperative pain. After surgery, the patients are put into an abdominal binder. They get to go home. We want to have them up and moving around the first day of surgery. And we'll see them back typically 2 or 3 days later in the office. Tummy tuck is a great operation to take care of problems that just can't be solved any other way. Typically hanging skin, mommy makeovers, or patients who've lost a significant amount of weight.